Hi, everyone. We are going to be talking about the gluteal muscles in this video. These begin on page 315. And we're going to talk about all three gluteal muscles. There's gluteus maximus, medius, and minimus. So please turn to page 315 and we'll get started. All right, here we are. So three gluteals make up the gluteal complex, really. And these muscles are sort of responsible for keeping us upright when we move. They are extenders of the femur. They are lateral rotators of the femur, but they also help stabilize the pelvis when we're walking. So the gluteals are extremely important, and I know that you will have glutes as part of your massage protocol. We will also talk about working the glutes when we get to neuromuscular therapy. So gluteus maximus is the largest of the three, and you can imagine because it's maximus. It's in the name, it means large. So this is the largest gluteal muscle. Gluteus maximus is the muscle that gives the buttocks its rounded appearance. But it is the deposition of fat on the gluteus maximus muscle, like above the muscle deep to the skin, that actually gives the buttocks its shape. Humans are kind of unique in that we have this line here that basically divides where we have a large deposition of fat, a large deposit of fat, and then where we don't. So even though the gluteus maximus muscle itself gives shape to the buttocks, it is actually the fat and subcutaneous tissue that gives it its appearance. Okay. We do have some cadaver videos, and you would see in those cadaver videos that the glute max itself actually can be kind of flat. So I don't want to give the impression that if you have large gluteus maximus muscles, then you're going to have a large buttocks, because that's not always the case. Okay. That's mostly genetic. All right, so gluteus maximus originates all in through here. So that's all the origin of gluteus maximus. And if you look over here, here's the O. See, we have the coccyx right there. We have the edge of the sacrum. We have the posterior iliac crest, which is right up and through here, and the sacrotuberous and sacroiliac ligaments. Okay, sacrotuberous ligament would be deep in here, and the sacroiliac ligaments would be deep in here as well. So they're not showing you those, but that's okay. So we had talked about these. The sacrotuberous attaches the sacrum to the ischial tuberosity, and the sacroiliac ligament attaches the sacrum to the ilium, and it would be kind of like in here-ish, like there, okay? The posterior sacroiliac ligament there. So all of that is the origin, okay, of gluteus maximus. Now, glute max has two insertions. We have this one right here, which is the gluteal tuberosity. Remember, we have this landmark in the corner. Yes, it'll show. Okay, this landmark right here, that's the gluteal tuberosity. It's kind of big. And we have another soft tissue attachment, the iliotibial band. Okay, the iliotibial band, otherwise known as the IT band or iliotibial tract, is a soft tissue structure that runs the entire length of the lateral thigh. You can feel it. It's very, very tough. When you push into your lateral thigh, you get some resistance. That's the iliotibial band or iliotibial tract. So we have an attachment here on the gluteal tuberosity. Whoops, I didn't mean to draw through that. And on the iliotibial tract or IT band, right? So two very different insertions. Okay, now as far as actions are concerned, for gluteus maximus, most of the fibers do most of the action. But as you can see, the lower fibers, and that's those in through here, because of their position on the femur, they actually can adduct the hip. So bring the leg closer to the midline of the body, right? That's adduction. The rest of the fibers extend the hip, laterally rotate the hip, and abduct the hip. So look, we have a little bit of antagonistic action going on here. Abduction of the hip. So if you stand up and try to do all these actions at the same time, what this ends up looking like is extension, lateral rotation, and my hip just popped. Lateral rotation and then abduction. It's actually, if you make like a J, so if you are standing facing away, you end up making a bit of a J shape with your toes. And I'm trying to mimic that with my arm because you can't see my toes. I cannot move my camera back far enough where you can see my whole body. It's not a big enough room, quite frankly. So extension and lateral rotation are really those main actions of gluteus maximus. And a lot of the exercises that you do for glutes really focus on the extension and the lateral rotation actions of this muscle. Maybe some of you work out, maybe you don't, but a lot of videos that target glutes really target gluteus maximus pretty much exclusively with extension, like you're always doing leg kicks or lateral rotation. You're always bringing your leg kind of out to the side. So yeah, those are the main actions. Abduction of the hip happens naturally because of its attachment on the IT band. It's pulling, these fibers are pulling this way, right? The origin goes, the insertion goes towards the origin. So the muscle's moving in this direction as it contracts, which kicks this whole thing out to the side in abduction, okay? All right. Now, gluteus medius, oh my goodness. Gluteus medius is a tricky little bugger. It is the deltoid of the hip, okay? The deltoid of the hip. It has fibers in 3 different directions. So we have the posterior fibers, we have the middle fibers, and we have the anterior fibers here. Does that sound familiar? Yeah. So gluteus medius is, partially deep to gluteus maximus, but not entirely. So we can palpate gluteus medius. All right, let's talk a little bit about the origin and the insertion. So the origin is the gluteal surface of the ilium, right? I mean, it's mostly in here between the posterior and anterior gluteal lines. So here our gluteal lines come back in. Remember I said they don't really exist. They're just there as muscle attachment borders. Well, here's one of them. So we have the posterior and anterior gluteal line. So the posterior gluteal line, remember, was right here. And the anterior gluteal line was right about here. So right in between those two is where gluteus medius originates. And if you take a look on page 316, it's a big origin. It's all of that shaded area. I can drag him over here for a second. So if you see this, all of this red splotch right here, that's all gluteus medius origin. You see what I mean? And this one will be another glute muscle, but this is all gluteus medius. So it's a pretty big origin. He is really heavy. So I have to set him against the wall or he will tip the whole stand over. It's very delicate. All right. So that's the origin. Gluteal surface of the ilium between the posterior and anterior gluteal lines just below the iliac crest. So it's just describing where it originates there. The insertion is the greater trochanter, specifically the lateral aspect of the greater trochanter here. Because remember, this whole thing is the greater trochanter. Lateral aspect of the greater trochanter. Now, because it is the deltoid of the hip, we have actions for all of the fibers, and we have actions for the anterior fibers and actions for the posterior fibers, just like the deltoid. So all the fibers abduct the hip, which makes sense, right? The insertion is going to move towards the origin. The fibers contract this way, which moves the femur into abduction. And this is really easy to feel. If you stand up and abduct your hip, you can feel gluteus medius, no problem. The anterior fibers flex the hip and medially rotate the hip. Flex and medially rotate. The posterior fibers extend and laterally rotate the hip. So again, like the deltoid, the anterior fibers and the posterior fibers are antagonists to one another. So let's stand up. We'll do it this way. If you put your hand right here, so right on the side of your hip, and I wear jeans purposely so you can see this, right where your seam is. Okay, if you have jeans on or any kind of pants with a seam like this, right where the seam is, put your index finger, okay? Now, abduct the hip. Ah, yes, you can feel all of this engage. You can feel it contract. Cool. Now, with your finger still on the seam, your index finger still on the seam, flex your hip. You don't have to flex a whole lot, just a little movement will do. You can feel those anterior fibers right about where the seam is. So flex and then medially rotate. So your knee is going to go towards the midline. If you're medially rotating, you can use that as sort of a landmark. And you can really feel those fibers pop out against your fingers there, right there. Okay. Now, the posterior fibers extend and laterally rotate. And for gluteus medius, you feel them right about where your third finger would be, your ring finger. Okay, so you can palpate this at home. These muscles are superficial, obviously. We're talking about superficial muscles at this point, but they're strong muscles. Like I said, these are involved in ambulation, moving from place to place. So they are going to be developed sort of on everybody. Okay, that's gluteus medius. Now we need to go to gluteus minimus, our third gluteal muscle. Gluteus minimus is on the next page. Gluteus minimus is entirely deep to gluteus medius. Therefore, it is not directly palpable. We know it's there. And when we palpate gluteus medius, we are pushing into gluteus minimus as well, but we cannot feel it specifically. Okay. So gluteus minimus origin is the gluteal surface of the ilium between the anterior and inferior gluteal lines. Okay, so there are gluteal lines again. The anterior gluteal line would be about here, and then the inferior gluteal line was about there. So this is our origin for gluteus minimus, right in through here. And at the bottom of this page, you can see that. So here was gluteus medius. Here's the origin of gluteus minimus. Okay, so the insertion then of gluteus minimus is the anterior aspect of the greater trochanter. See, anterior aspect of the greater trochanter. Since it inserts anteriorly, we're going to have those anterior actions like flexion, medial rotation. Okay, so it was very much like the anterior fibers of gluteus medius. It flexes the hip and medially rotates the hip. And like all of the glutes, it also abducts the hip. Okay, all of the glutes abduct the hip. Gluteus minimus is no exception. Okay, it is small but mighty. And that's really it for gluteus minimus. So when do you use your gluteals? Well, I had mentioned ambulation, of course, running, cycling, swimming, skating. Anytime you're using your legs, you are using your gluteal muscles. Climbing stairs, yes, absolutely, especially Maximus. Latin dancing, sure. Any kind of dancing, actually, you're going to be using your gluteal muscles. Any action in which you use your legs, you're going to be using your glutes. And again, we can see the origins here in black and the insertions here in red. And of course, this one's hanging off to the side because it's soft tissue attachment. Okay. All right. That's it for gluteus maximus, medius, and minimus. I'll see you soon.